p.m. Monday, April 12th, 2021. And I'm calling to order the regular meeting of the Boulder County Board of Health. Can I ask all board members to introduce themselves? I'm Greg Thomas, Board President.
This is Brooke Harrison,
Fagan.
Board Member.
This is Landry Fagan, Board Member.
This is Morgan McMillan, Board Member.
Okay, and Jorge is sick today, so we have 4 board members and we have a quorum. Lexi, I know we have the county commissioners on, and I'm not sure if how you want to do introductions or if you want to do introductions for staff.
Sure, I will just mention who is here from Boulder County Public Health. I'm Lexi Nolan, Acting Executive Director. We also have Chris Campbell, Sheila Davis, Tammy Golden, Kelly Hinch, Rita Mangan, Trina Ruland, our legal support from the county, Angela Simmenthal, Chris Urbina, and as a guest, Carmen Palacios Ramirez, who will be speaking with our group on the equity response this evening.
Okay, thank you. And commissioners, would you like to introduce yourselves?
Good evening. This is Matt Jones, Boulder County Commissioner. Glad to join you.
Good evening. This is Martha Lochamin, Boulder County Commissioner, District 2. Thanks for the invite.
I am Claire Levy, Boulder County Commissioner. Happy to be here and eager to hear what we can learn from one another. Thank you.
Great. Thank you all for being on. Okay, so we do have a quorum and we'll get going with the meeting that's been called to order at the discretion of Interim Executive Director Lexi Nolan. Notice of this meeting was posted on the board's website as required by law. Due to the current COVID-19 pandemic and the need for social distancing, we are holding this meeting telephonically as authorized by the Board of Health bylaws. Okay, so do we have any public comment?
Greg, we're going to push that after item 1.
Oh, sorry, I'm just looking at the agenda. Okay, so item 1A. Update on current COVID-19 trends.
Thanks, Greg. Can everyone see this? I so often have a problem with figuring out how to share this.
Not yet, Lexi.
Not yet, okay. One more time.
Looks
And what
good.
about now?
Yes.
Yes.
Great, thank you. Okay, so what we'd like to do this evening is to give an update on what we're seeing as trends in cases and vaccinations, and give you a little bit of information about our equity responses and how we're working with communications and outreach, and answer any questions that you have about how you can support messaging to the public. As well as request an additional public health order that will facilitate us to gradually step down the dial as opposed to suddenly moving quickly out of any kind of restrictions, which some of the data is showing could present some real complications in terms of deaths, hospitalizations, and controlling surges. So I'm going to show you some familiar slides. Our incidence, our case incidence this week is 150.4, which is improving from last week when it was 170.7, but up from a couple of weeks ago. We've been trending up lately. This week we're down a little. Our positivity rate similarly is down a touch. This week we are in blue in terms of positivity at the moment. And we have 8 days of decreasing and stable hospitalization. So this indicator is actually worsening since last week. Our 7-day average of cases across metro counties, you can see that we are well below the other counties, but trending up from several weeks ago. Our hospitalization rate has been lower lately, but at the moment is, as we said, spiking up a bit. And what we're seeing is generally proportional increases. As our case rates increase, they are generally proportional across our municipalities and unincorporated areas across the county. Additionally, we see that cases are going up, but our inequities are going down among different ethnic and racial groups. And this is not an updated slide from this week, but from last week, but I wanted to present it to you because you can see the age breakdown. That what we're seeing is trending cases, particularly among the youth, which of course is less vaccinated, has had less time to get vaccinated. And of course, they have returned to school in the last few weeks. So it's not entirely surprising that we're seeing upticks in youth, but we are concerned about these increases because we know from emerging science that exposure to COVID is being recognized to have increasingly recognized to have lasting effects on kids, including neurological impacts. This is one of the most important slides I wanted to share with you. This is projections from the Colorado School of Public Health. And what it really shows is what the impact on additional deaths, not deaths, but additional deaths would be if we suddenly change policies related to masking and social distancing, as opposed to delaying those policy changes for 1 month. And what you can see is that if both are removed, we see very high levels of additional deaths. This is not deaths, this is additional deaths. And even by delaying 1 month to May 15th instead of April 15th, when the governor is expected to remove the dial, just delaying 1 month brings those additional deaths way down here. And as you all know, we last week we changed the mask order to only require masking indoors. We released the outdoor masking requirement. That was based on a lot of emerging science that's showing that transmission isn't occurring nearly as significantly outdoors as it is indoors. And what we would like you to consider this evening is that second piece about how we step down restrictions so that we aren't ending up in this situation, but rather are stepping down so that we begin to look more like a conservative estimate of impact.
To clarify, Lexi, that's statewide modeling?
It is.
Thank you.
So just to summarize, we're seeing cases, percent positivity, hospitalizations increasing, and the state is saying Colorado is entering a fourth wave. Time will tell. We're not seeing significantly increasing deaths at this point, but we are very concerned about what the modeling is showing that the death impact will be if we suddenly remove restrictions. The variants are creating challenges for us, especially among unvaccinated folks, and the B117 variant is the most prevalent by far at this point in Colorado, but we have 5 other variants also identified. Transmission control is still at 68%, which is good. We need it to stay up high, and part of the way that we keep it up high is we maintain some restrictions and some social distancing controls. And we're seeing about 1 in 207 Coloradans infectious right now. So kind of in summary, if the vaccinations continue as planned, if we don't have significant disruption in the supply chain, if we delay the removal of the mask mandate as we did last week, and delay the dial step down for 1 month, we're projected to prevent a large number of deaths and hospitalizations across the state. And that's what we're proposing this evening. Right now, I'd like to turn it over to Chris to talk a little bit about where we are with vaccinations.
Thanks, Lexi. Really appreciate it. Hi, everyone. Again, Chris Campbell. I'm Emergency Management Coordinator with Boulder County Public Health and Vaccination Lead, working with incredible teams across the county in our vaccination endeavor. I'm just for the group and for the board, for the commissioners, I'm going to share some data, and you'll hear from Sheila Davis and Carmen Ramirez, who will talk how we are really implementing now. You've heard us talk about our equity strategies. They're going to give some updates on that and how they're working. This data is going to set the stage for that on where we're at generally as a county. Well, we should celebrate. We have vaccinated the community with at least one dose, 145,000 community members. It's about 53% of the eligible population. And relative to both the Colorado and national average, we're well ahead and making good progress. So I just wanted to set the stage with that data point. Next slide, Lexi. We'll share these afterwards for the commissioners and the board. Just this shows the progress we're making in each of the age categories. It's really heartening to see older community members, really those numbers going up for older adults in the community. And even the 60 to 69 age group, about 80% of that group is now vaccinated with one dose. Those numbers are really great to celebrate. Next slide. We like to share this. You've heard me talk in the past about the general providers, the kind of system that we've created in Boulder County, the ability to provide a certain number of vaccines a week. We're now providing for the community about 26,000 vaccines per week. And we know, and I'll share a slide here about where we're projected to be to vaccinate 70% of the community, even 100% of the community. And what this does show is, there's a lot of providers in Boulder County and across the state really stepping up and really meeting that need of providing vaccines for community members. This just shows where we're at generally in the metro area, and it's, again, good progress to celebrate. About 46% of the eligible population is now vaccinated across the metro area, and Boulder and Bluefield are leading the way there as well. Okay, this just shows, again, that's really shows where we're at in terms of the community and those who are making that good informed decision to get vaccinated. We showed some of those numbers, but Boulder and Bluefield, again, leading the way in terms of across the state, community members making that good choice to get vaccinated. Another slide just showing relative to the state where things are at. And these are vaccine rates for 18 plus. And we also know, and we'll talk about that, we do have some work to do in Boulder County. This might be a little challenging to see, but it shows where we're at with our BIPAP community members, and we do have some work to do, and we'll share that work we're doing to ensure equitable access to vaccines currently. Just shows, again, a little different form of where we're at with that community. Another slide here, we wanted to show this because we wanted to show this relative to our BIPOC community members. Again, Boulder and Bluefield really leading the way in the state with older community members. Again, something to celebrate. We just want to set the stage and give some context for the board and for the commissioners on where we're at with the vaccination campaign. Same slide here, just shows a little different way. And this shows really where we're at with community members, BIPOC community members. So we are making good progress there relative, to the rest of the state. And, it does show, that the older adults, which we know are impacted by COVID, they are accessing vaccine. And again, we know we have work to do for community members. Again, just another statewide view to show where we're at. And I know that Sheila and Carmen will talk a little more about this. You've heard us talk about our equity clinics, our equity strategy. We really aspire to do about 5,400 doses per week for priority populations in Boulder County. We have locations throughout the county that are operating on 6 to 7 days a week. And we do have mobile clinics to really address those gaps, and we'll continue to do those. A good example is on Friday, it's been a long weekend, we were able to go to the Boulder shelter and vaccinate 50 community members there with Johnson & Johnson vaccine. So, these are kind of the gaps we see, the ability to be really flexible or agile and cover those gaps. But we also have existing clinics throughout the county that we're leveraging on the equity side, making sure they're welcoming, working with community ambassadors and cultural brokers to ensure that folks have access to those. So these again serve priority populations. We also, this is for the community, if they are able to call our call center currently, if they're really struggling with access. And we do have a culturally diverse staff with our call center now helping with registration. And I'll just end here, and I'll turn this over to Sheila. Given we're just projecting, we want to help the community understand where we're at in terms of vaccinating the community with at least one dose. We're making incredible progress, and this does tie into the data that Lexi shared in terms of where we're going with orders. So our goal really is to really have that first dose to community members by the first or second week of May. So this is, again, if the supply chain remains stable, but we're making good progress, and that is our goal.
And I just want to interject
Go ahead, Lexi.
something here real quick. That if we look at the projections and we go out to the middle of May, which is when we're proposing to delay the policy changes, that puts us here at about over 80% of the county having at least one vaccine. And that's what we're looking for, is just to get up as high into this vaccine range as we can before we really release all restrictions.
Okay. So we'll turn this over to Sheila Davis, who's our equity coordinator, to talk about a little more in detail about our vaccine equity work.
Thank you, Chris. So for some background, in October, we realized that if we were going to achieve the goal of herd immunity, that is about 80% of the population vaccinated, we would have to deploy strategies that were proven to be successful in reaching those with barriers to vaccine access. And some of these barriers include inability to utilize online resources, lack of healthcare provider relationships, distrust of, lack of confidence in healthcare services, lack of mobility, transportation access, and absence of necessary support resources. And I refer to these groups as difficult to reach. And populations that have been identified as having barriers to vaccine access include people of color, people identifying as LGBTQ+, people living with disabilities, people who are unhoused, seniors, and people in the mountain communities. And each population has a unique set of barriers to vaccine access that requires tailored approaches to building vaccine confidence and access that leverages existing trusted relationships among these groups and local organizations. By leveraging these existing relationships, BCPH can engage with these groups to increase vaccination rates in a more expeditious and effective manner, and that has been the foundation of our strategy. So the Community Ambassador Program, which was conceived of by Metro Denver Partnership for Health, is all about using tailored approaches to build vaccine confidence and access by leveraging these existing trusted relationships that community-based groups have with difficult to reach populations. So we invited several community-based organizations to become community ambassadors in November to promote the importance of flu and COVID-19 vaccination to their networks. And at that time, Intercambio, El Centro Amistad, and Out Boulder were among the first to join and become community ambassadors. However, in December, when the vaccine rollout began and we realized how messy it was at the national and state levels with issues of registration and limited supply of vaccine, we realized that we needed to engage these organizations at a deeper level and that we needed to apply some of the recommendations of Resiliency for All, one of which called for the shift in dynamic between communities and local government. So these circumstances led to the emergence of the Vaccine Equity Coordinating Committee, the VEC. I know it rhymes with the HEC. And the goal of the HEC is essentially to make sure that vaccine uptake mirrors the percentage, the rich diversity of the Boulder community. And our approach is all about co-designing vaccine equity clinics using a shared leadership framework. And this is rooted in the MDPH Vaccine Ambassadors Program, as well as the 2020 census approach. Next slide, please. So the VEC consists of community ambassadors, and they include El Centro Amistad, Out Boulder, El Comité, Peak to Peaks, Center for People with Disabilities, and the El Paso movement. It also includes vaccine providers like SEL, Clinica Salud, BCH, as well as community influencers, Intercambio, NAACP, City of Boulder staff, City of Longmont staff, Carmen is my co-lead, and others. Next slide, please. So we had a narrow window of time to plan and execute our vaccine equity strategy, and this window has become even narrower as we race to flatten the fourth wave because of these more contagious variants. And we knew that vaccine hesitancy was an issue for our priority populations. Further, this group had never worked together before, and there were some trust issues. Nevertheless, we have made some progress. We have a scope of work for the community ambassadors. The community ambassadors are doing the heavy lifting around registration, supporting community members with hesitancy or limited IT or English proficiency, sharing information about our various clinics. They are participating in quarterly trainings with MDPH, and they are volunteering at our vaccine equity clinics. We also have created a framework for our vaccine equity clinics, and we've engaged in shared decision-making around volunteer staffing, registration, outreach, wait lists, and selection of sites for our equity clinics. And we also have quality control built in. For instance, last week we had a clinic and there was some misgendering and some microaggressions, and so now we're using cultural responsiveness as part of our orientation before every clinic. Next slide, please. So what does a COVID vaccine equity clinic look like? This looks nothing like corporate medicine or academic medicine. In previous lives, I've worked in both settings. You'll see in the photo volunteers from Out Boulder, volunteers from El Centro Amistad. You receive a warm welcome. There's signage, bilingual signage. When you walk in, this was at the Timberline Elementary School. We had a clinic on March 17th and March 24th, and we're having one this Saturday and next Saturday at that same location. You will be, either Carmen or Marty Moore will check your temperature. Then you'll proceed to registration, and there's a culturally responsive bilingual staff to check you in. And then you are vaccinated. Then you proceed to observation, and it's a sort of socially distanced, sort of a social area gathering while you wait for 15 minutes and you're observed for any evidence of allergic reactions, or 30 minutes possibly. And then there's a DJ as you leave the building. So this is a stark contrast to my experiences in academic medicine and corporate medicine. When I trained in the 90s, it was at the height of the HIV/AIDS epidemic, and physicians would often there were some physicians who would not treat people diagnosed with HIV/AIDS, and they did this with impunity. There were no consequences. And even now, in the state of Tennessee, there are mental health care providers can refuse the right to provide care to people identifying as LGBTQ. So this is certainly a breath of fresh air, and this is just the beginning. Next slide, please. So the challenge is now we have this infrastructure, this equity clinic infrastructure, but we have to reach the most difficult to reach. That might be someone who doesn't speak English, who may lack documentation, is homebound. So how do we identify those groups? That is our challenge now, and we will need our community influencers to do that work. And I will now turn it over to Carmen.
Good evening, everyone. Carmen Ramirez, City of Longmont, and working in partnership with Public Health and Sheila Davis on the Vaccine Equity Committee. We're going to talk a little bit about ambassadors and influencers. And again, repeating what Sheila had said earlier, we're working with the trusted culture brokers that are within nonprofits or community leaders. They're that point of connection. So our community ambassadors are doing that outreach and registration. It'll be very important when we reach the folks that have the highest barriers or have highest hesitation for a variety of reasons. And then the community influencers are the circle of folks that can help us distribute information and connecting folks to assistance to register. So that's like SUMA, community and agency partners. We're going to be doing a meeting with our community partners and asking folks to really be that point of distribution of information and that bridge to connecting them to community ambassadors. Next slide, Lexi. So what we're doing is sharing that information, training with community partners about the vaccine, how to access the clinics, how to register and provide assistance, connect them to that assistance. Emphasis on our priority populations and accessibility. So the 14th, we'll meet with community partners. What that looks like, if you think of within the county, someone comes in for an appointment with WIC, and someone asks, the person within that time will ask them, do you need information on the COVID vaccine? Do you know where to sign up? Can we connect you with someone that can help you with that? We'll do the same on the 21st as we have a cafecito with cultural brokers. So we're working all level of cultural brokers from the informal to the formal. On the 28th, we plan to do more of an in-depth orientation for folks. What if this question comes up? Or what if they have transportation problems? Where can I find resources? So we'll be providing, Angela has helped us pull together great talking points for different communities in Spanish and English, GLBTQ. We have a flyer, and then we'll kind of walk through with folks. Not everybody is equipped right off the bat to say, here's where you go and this is what you need to do. And whatever access problem you have, I know where there's a solution for that. So we'll be walking folks through that. And I think that was the last of my slides.
Angela?
Hi, my name is Angela Cimental. I am the Communications and Marketing Manager for Boulder County Public Health. I just have a brief overview of the communication that has been strategically created and implemented to address some of the communication gaps with our partners in the community. So I'll go over some of the bilingual and bilateral communication we have provided. For our web pages, we have a very robust and easy to use provider page. It is one of the most visited pages on our website, and it's updated frequently. You can reach it right from the main landing page. We also have a new web page which focuses on COVID vaccine general information. We address hesitancy, any vaccine allocations, outreach opportunities such as the town halls, and resources for people experiencing barriers. And we also provide a list of frequently asked questions that those pages are both bilingual. Like Carmen mentioned, we have 10 toolkits. This tailored toolkits, we have a general toolkit, one for the Latinx community, LGBTQ+, and the ADA community. These are guiding bilingual and culturally relevant documents that give our ambassadors and influencers information and resources to help the community with general COVID vaccine information, sign up, and providers addressing hesitancy. And overall, we cover 18 topics. The toolkits are complete with flyers and other easy to access resources. And this is part of the equity strategy, which is community driven. Each toolkit was informed and co-designed by our partner organizations. And I just want to give a huge thanks to our community partners, because we couldn't have done this work without them. Everything that we create, we align those messages and those products with our partners, which include our PIOs in the region. We also share it with cultural brokers, our partner SUMA, and many other community organizations through our cultural brokers, influencers, and ambassadors. That's my update. Thank you.
Thank you, Angela. So just in summary, we had been asked what are some of the key messages for the Board of Health and for our commissioners to be able to take back to the community. Some of the key messages are that right now the epidemic curve, the curve of how cases are going to roll out, is a little bit uncertain. We basically have an 8-week focus on vaccines and transmission control. We're racing a bit against the variants. But even if people can get one vaccine, that confers about 80% immunity, and that's terrific. We have plenty of infrastructure to deliver vaccines. We really are waiting for additional supply. Unfortunately, there's been a little disruption in the supply chain lately, so we aren't getting quite as much as we had hoped for, but we are expecting it to continue at least at this pace, which puts us on a good trajectory for full vaccinations by the end of May or early June at the latest. We will continue to see some disparities as we work to catch up. One thing that was challenging was that the governor decided to release eligibility to everyone over 16 several weeks earlier than we had been planning, and that made it a little bit more challenging for us to make sure that some of the most vulnerable community members got vaccinated. So we are still catching up in that space. We are also expecting vaccines for ages 12 to 15 to have emergency use authorization approved within a number of weeks. And we may even be able to see eligibility for ages 6 to 11 over the summer. We are hoping that we have a chance to vaccinate the kids before school starts in the fall. So our strategy is to hold down cases until mid-May, when the vaccination rates are much higher, as we've described, to keep the indoor masking, to keep some restrictions in place for 1 month to significantly reduce deaths, hospitalizations, and a potential case surge, and to use our strategy of reaching priority populations through ambassadors, influencers, and our community equity clinics.
All right, thank you, team. Let's see, how do we want to do this? Tammy, is this where, Morgan, you have a question. Why don't you go ahead?
Yeah, thanks, Greg, and thanks to the staff for providing that really helpful update, and thank you for all the work that's gone into this vaccination process. I have to say, Chris, you told us, I don't know, a couple months ago that we were going to be able to do 25,000 vaccinations in a week, and it's amazing that we are able to. So congrats to everybody. I wanted to ask a follow-up question that came up at the last meeting in regards to the equity question. We talked about, it wasn't clear, I think a month ago when we last met, whether or not we had an access issue for, in particular, BIPOC communities or those hard to reach communities, or if we had a hesitancy problem and what was the leading issue there. And so I'm wondering if we have more information on how that is playing out in the community. And then additionally, I'd love to hear from some folks who are kind of on the ground, on the front lines, about how it's going, how they're hearing, what they're hearing from community members. I'm sorry, I've got background chatter. Kids are home. So if I don't know if there's anyone, I was hoping Jorge was going to be able to join us to be able to speak from his perspective too, but I just am wondering what folks are hearing in terms of challenges from hard to reach communities and BIPOC communities. Thanks.
Carmen, do you want to start, or I can jump in later?
I'll start. So I think what we're seeing right now is a lot of gratefulness around access that is closer to home, that it's within the neighborhood. So there's that first phase. I think we will be reaching those folks that were more hesitant. The issue as we kind of work on providing access, Morgan, what we're finding out is the trusted sources can answer the questions around immigration status, around fees. Is there a fee for this? What do I do with my employer? So as we move through and we're providing the access, hopefully we are answering some questions around hesitation, but I think we'll still see folks in the community that are hesitant, whether they're just not trusting around issues of immigration and so forth. But I think with the access, we'll be able to get a lot of folks that might have been hesitant for other reasons. What I heard, and there's a variety of clinics that are popping up, whether it's a state equity or even Servicios de la Raza, as well as public health. That message will get out there and people are going to say, okay, everybody's doing this, I can do this. There isn't that fear around immigration or cost or anything else that they may have a hesitation about. Sheila, I don't know if you want to add to that.
I just want to add that the people are continuing to be hesitant. I'm picking this up in the town halls and with the questions they're asking. So hesitancy is ongoing, and that's why the town halls are so important.
Yeah, and thanks, Sheila and Carmen, for that additional information. I guess I'm wondering, Carmen, do you feel like people who want to get the vaccine are able to get the vaccine? Or, I mean, do we have an access issue beyond hesitancy? Because again, we've talked about this at the board with, hesitancy is a longer play, right? It takes more education and make resources and time. But as people are ready to get the vaccine, are they able to get the vaccine? And are we doing enough to remove barriers to access? Is that what you're hearing from folks in the community?
So there's a little bit of the issue of being able to get to working folks on weekends and on the evenings. So that definitely is going to continue to be an issue. We're trying to funnel folks into the other clinics, but that's still going to be an issue. At the fairgrounds, the time frame that we have is during the week and during the day. Salud Clinic is also looking at expanding their hours. The Timberline Clinic, that was exactly why we did it on the weekend, so that we could provide that access. But I think that's going to continue to be an ongoing issue. Servicios de la Raza did a drive-up clinic on Saturday, 1,000 folks, or 1,000 vaccines. So yes, you're still going to continue to see those kinds of access problems, whether it's trust, whether it's time and day, or questions around immigration status. And then I think the other piece is feeling like they're going to be welcomed into the clinics. And we work very hard with public health around that. And I think we're getting there, but we're not there yet.
I would say the additional factor that is unfortunate is that the supply is not what we were quite hoping it would be at this point. We did plan for this, but we were hopeful that the supply would actually get a little bit closer to our capacity. And so we are still hearing from people that, it's challenging to find open slots. And, this is part of a systems problem from not having a coordinated registration system, which is that people register in multiple places. They get in one place, they don't necessarily cancel their appointment. And so that second appointment is kind of wasted time, or can be. And so we're trying to figure out, where some of those solutions are, but that's a pretty difficult problem. What's good is that the strategy of working with cultural brokers and our community partners really allows us to address both some of the access barriers as well as the hesitancy issues at the same time.
Brooke, you have a question? While we're waiting for Brooke,
Oh, sorry. Can you hear me now?
I can.
I unmuted and remuted myself. Sorry. So along those same lines, Lexi, so Chris has mentioned several times that we're getting a very small number of vaccines. In regards to the equity initiatives, is it appropriate to partner with other counties that are not seeing as many limitations on the number of vaccines that we're getting? And then the second question is along the lines of what Morgan was asking. Since these populations were harder hit by COVID, is the fact that they're barred from being vaccinated or should not be vaccinated for 90 days after having positive COVID test, could that be impacting the rate of vaccination in those populations at all?
So I will say the vaccine supply, and Chris, correct me if I'm wrong, but the vaccine supply is not what we hoped it would be. It's still about 2.5 to 3 times as much as we were seeing even a couple of weeks ago. So it has scaled significantly.
Yeah.
In relation to partnering with other counties, the allocation is really decided at the state level based on county populations. The only thing that creates variation in that space is whether a county happens to have one of the state pods, or if there are, a whole lot of folks that are doing vaccines on the side, or whether there's particular providers, like for instance, Salud gets extra vaccines as part of a national partnership.
If you guys wanted to take a bath, that'd be great.
Could folks mute if they're not speaking?
Love that. Almost, but I'm waiting for.
Hello, can you mute, please? Thank you. And I'm not sure, Brooke, if you can clarify what the barring folks for 90 days issue is.
Oh, just the suggestion that if you've had COVID, if you've tested positive, that you should not be vaccinated for 90 days. You should wait 90 days. From talking to people, I've been hearing a lot of people say that they want to get the vaccine, including people in the populations we're targeting with the equity initiatives. And so they're kind of sitting and waiting out their 90 days before they come in to get vaccinated.
So that's no longer a requirement, this 90 days. So at one point that was an issue, but it is no longer. And I understand, Dr. Urbina may have more to add to that.
Agreed. I think that was one of the misinformation issues that are still out there. And I think that's part of our challenge of our group of Sheila and Lisbeth and also Carmen, is that how do we override the misinformation that's circulated? Because right now we know, Sheila testified, and we still have to push this information out there. You can get the vaccine as long as you've completed your isolation and you've recovered from isolation. You can get it at any time. So that's part of our challenge is as the information changes, we have to update that information in our communication strategies. So we'll continue to work on that. Thank you for calling it to our attention.
And I'll pass that along because I've heard it multiple times.
Okay, we time check. It is about 6:15. I want to give the opportunity for any of the commissioners to ask questions before we move on to the public health order, because we do have somewhat of a firm stop at 6:30 to get that item 1 on the agenda wrapped up.
I'll jump in. This is Matt. Thanks for having us. And if there's a reporter on the line, please report that 90-day false hood going around. That would be great. Get the word out. That's one thing. Second, I really want to thank this staff, Sheila, Carmen, and the Vaccine Equity Coordinating Committee for doing great work. I mean, it was enlightening here, hearing the access versus the hesitancy and how they're interrelated and how you need to keep working on it. And I bet word spreads, right, as you do your work. So thank you for that. Also, I want to thank the public health staff for being so adaptable. These decisions come down from the state last minute and often on Fridays. And we try to head that off as commissioners, working with your staff, but have had very little success. But you're very positive in the way you respond to that, and I appreciate it. That must not be easy at times. And then finally, I support you extending, to be really clear, Boulder County Public Health and the board make the decisions on health issues in Boulder County, not the county commissioners. I've been saying that for a year now to a lot of people. And I think that's the way to go. I think it should be more health and science-based than political. But my opinion is I fully support you extending the mask order another month. When you're dealing with a disease that's very contagious and can be deadly and can grow exponentially, caution is the way to go, and I really support you. So I'll just finish there by thanking all of you. No question in there, but I want to appreciate all of you.
Thank you.
And this is Claire Levy, County Commissioner. I don't have anything to add. I know you have some things to get to on your agenda. I echo all of Matt's comments, especially his thank you to you for working under these difficult situations and dealing with a constantly changing landscape. So I am just appreciative of your work. It was nice to get to join you. I hope our good collaborative relationship continues, and I'm going to let you get on with your work. Thank you.
Thank you, everybody, for the presentation. I may be the only county commissioner with questions. My name is Martha Lochimine. I'm in District 2. I live in Longmont. Two things. One, just because, you know, there's public on the line, et cetera. I was with the Mobility and Access Coalition earlier this afternoon, and they shared that they've been able to reach 760 folks who are through via transportation to provide transportation for folks who are, as you said, homebound or up in the mountains, et cetera. So I just wanted to make sure that we shared that out for folks so that people know, similar to the comment that Commissioner Jones said, you know, what else education-wise can we share with folks tonight? So, and I also just had a couple questions in regards to the, you know, how are we funding, supporting this work? We know public health has been completely overworked, overtasked. And so I just feel like that needs to be at least stated when we say thank you for your work, because you're all doing amazing and responding and dealing with, you know, the state mandates and things like that. And, you know, how can we support those efforts? The other question would be kind of a long-term question, especially when we look at some of the ARPA funds that are coming in, et cetera. We haven't talked tonight, and there's so many issues to talk about, but there's this piece of the effects of COVID, not only for the public health workers who've been on the front lines of all of this for over a year, but also survivor's guilt for our community members who have lost their loved ones, who are going to be dealing with some of the things you noted around neurological disorders and the long-term effects of COVID. So just curious if, you know, where that might fit, not necessarily for an answer tonight as much as where that fits in the planning for all this work as it continues. And then that other question around, you mentioned our Resiliency for All, the Resiliencia para Todos work that Carmen Ramirez and I did several years ago after the flood. And you mentioned that question around community trust. And so again, that long-term piece about how lessons learned in COVID, and just really, I'll be really interested to hear and hopefully participate in conversations about, you know, what we learned through this particular health disaster and emergency. So, but I do want to echo the thank you to all of you, and thanks for inviting us this evening, and certainly to invite the public to also share in the conversation. I had one question around transmission control that was in a slide that had this state trends title, and it looked like that was transmission control 68%, 1 out of 207, but I'm assuming that's the state based on the title of the slide, and just wondered if you had Boulder County numbers as well that you could share with us. So I'll stop there. Thank you so much.
Greg, would you like me to do a quick response to Marta's questions? Okay, so Marta, thank you very much for those questions. There's a lot in there, and we won't be able to address all of it tonight, but I do want to let you know that we, you asked how we're funding it. There are a number of different funding streams, and we're working really hard right now to sort out the budgeting structures so that we can make the most use of all of the funding that's coming in, and see where any gaps might be. That's going to take a couple of months for us to work through to get a better sense of where we're going to have gaps, and particularly for the longer term work of, you know, how do we mount a community response, not just an agency response and how we recover ourselves, but how do we support community recovery, which, you know, as you mentioned, there are some kind of hidden issues at the moment in terms of not just staff mental health, but community mental health, as well as some of the ways that problems have been hidden because of the mechanics of the virus and keeping people sequestered and not allowing us to do face-to-face client visits and things like that. So we are working on thinking about that, but it'll take a little time. The long-term community trust issue is, you know, we have been really intentional about really creating a vision of using this opportunity of partnering with our community partners, not just in the response, but as the beginning of a long-term relationship and a way of working that is more centered in co-development of work and community leadership, in identifying priorities and building that level of trust. So we definitely see that as a long-term opportunity. And finally, you asked about transmission control in Boulder County. It's right at about 68% also.
Great. Thank you. Thanks for that.
One thing I also wanted to mention, I want to thank the Board of Health members for help going through this bumpy ride for the last year. We see it, we know it, we see some of the mail, and you're being supportive of staff is just great. So thanks so much.
Yeah, you're welcome. And thanks again for making the time to get on and to share your comments and questions. We are going to move on to item 1D, which is the amended public health order. Lexi and Trina, I believe, are going to run that show.
Thank you, Greg. Trina, would you like to kick us off?
Sure. This item is a request from the board to authorize Lexi to enter what we're denoting Public Health Order 2021-04, adoption of Boulder County COVID-19 dial. And this is what Lexi alluded to earlier, to put protections in place for the next month based on that modeling from the state in order to reduce the number of deaths and hospitalizations over the next 4 weeks. We have been working, Lexi has been working very closely with our Metro partners, and we anticipate, either they have or we anticipate that they will request to enter similar orders so that the Metro County is moving as a region to ensure consistency across the Metro area. The public health order proposes that we move on April 16th, which is when the state order will go away, except for some very limited circumstances. On April 16th, we'll enter what we call phase 1, where we move into what we hope it will be level blue if our metrics stay good over the next couple of days. And that means that businesses will have some slightly expanded capacities. Right now we're in level yellow, and we'll remain in level blue for 30 days. Now, in the event that our metrics worsen significantly so that they're moving into the level orange metrics, where our positivity is exceeding 7.5% or 300 cases per 100,000, then we would stay in yellow for 30 days. Right now, it looks pretty good, like we're moving towards blue, but the public health order is written that way. And I just want to be clear about that if we are looking worse, we would stay in yellow. But if things stay on track as they are, we would move to blue for those 30 days. We would adopt the state order, the state dial order, in order to have consistency for our businesses. This is a framework we've been operating under since, I believe, last June or July. And part of the goal of this public health order is not just to reduce transmission, but to also keep consistency for our businesses, as we've heard feedback that change is often unwelcome. So the public health order would have really just a couple of minor tweaks to the dial. Most specifically, under level blue, outdoor events would no longer have a restriction under the way the state wrote the dial order. We are just requesting that if you want to have an outdoor event of greater than 500 people, you would have to submit your plan to Boulder County Public Health so that we just have the opportunity to see it and review it. And if we have any concerns, we would reach back out and express those concerns with the organizer or the business. We are intending on continuing the 5-star program under this proposed public health order. And the proposed public health order also just defines, for a little more clarity, indoor personal social gatherings, specifically indoor personal social gatherings, should really be limited to 10 people. Part of the purpose of this order is to encourage people and businesses to move gatherings outside whenever possible. This public health order will go in concert with our face covering order, which this board approved last week. So they are separate orders, but they do work together to help control the spread. After May 16th, this public health order would remain in effect, but we would move to what we are calling level clear, which is basically our new normal, what we felt like closer to pre-pandemic, with no capacity restrictions and no required mitigation efforts by businesses. So they may still continue to do them if they want, but they don't have to. And we would move into this level clear for 90 days until August 16th. And the purpose of level clear is to monitor the situation. While we're in level clear, if we start seeing a pretty dramatic increase in hospitalizations, and the metric we've chosen is one that we've only seen during surges. So if we were to see a surge in cases, we would move the county, the order would move the county back into level blue, yellow, orange, or red, depending on exactly how bad that surge is. Level clear would then expire on August 16th. And these dates are aligned with what the other metro regions have proposed to their boards or have already implemented. And I know we have a deadline of 6:30, so I can answer any questions for you, but that is the basic big overview. We're including with the proposed public health order a capacity chart, which is, for all intents and purposes, identical to what the state has proposed, with that addition of the 500 person, you must submit just a notice to Boulder County Public Health between April 16th and May 15th, so that we can monitor those large events and to encourage those large events to happen after May 16th, when we anticipate far more vaccine will be available. So unless the board has any questions, we request that the board approve that Lexi can enter Public Health Order 2021-04, as well as amend, modify, or extend to keep us in alignment with the other metro areas.
Any comments or questions from the board?
This is Morgan. I move to approve the Public Health Order 2021-04, adopting the COVID-19 Dial 3.0.
Do we need to include the amend, extend provision?
I think that's always helpful. I would consider it part of the order, but yes, I think explicitly providing the authority to amend, extend, or modify would be very helpful.
All right, I will update my movements. Morgan, I moved to approve Public Health Order 2021-04, adopting COVID-19 Dial 3.0, with the ability of the Public Health Director to amend or extend as needed.
This is Brooke, and I second.
Okay, we have a motion and a second. All in favor? Aye.
Aye.
Okay, motion carries. Thank you very much, everyone. Thank you again, commissioners. And Tammy, I did it with 1 minute to spare.
Thank you.
Good job, Greg.
Okay. Let's see. Now, item 2, which is public comments. Do we have any public comments? Anybody on the phone?
This is Joe Jackman with the Page 2 5-star team. I'd love to ask a quick question if that's possible.
Excuse me, could you please spell your name and give your address for the record, please?
Yep. My name is Joe Jackman, Joe space Jackman. And my address is 5123 Williams Fork Trail, Boulder, Colorado, 80301.
Go ahead, Mr. Jackman.
Around the move to blue, I understand, especially with the outdoor events and the science behind it now stating that outdoor events don't really have nearly the ramifications we originally thought. Though my question is, with all of the numbers moving into a worse place and most of them already being in yellow, if not moving into yellow, what was the thought behind the decision to move to blue?
So the governor is updating the dial to release restrictions significantly. And this was an attempt to balance the public health needs and the economic recovery needs, recognizing that we are moving into warmer weather, that vaccinations are increasing, and that we are maintaining an indoor mask mandate. And this was felt to be a good balance in protecting the public health and also allowing us to move toward a situation that looks a little more normal with some guardrails to prevent any kind of surge from getting out of hand.
Gotcha. Yeah, my biggest concern, I guess, as the public, and I am in my mid-20s, is the worry of the long-term effects of this. And the hospitalizations may be going down, but it may be a long-term effect kind of problematic situation. And with the mask mandate being put in for another month, it seems like it may be worthwhile to try to reduce the spread as much as possible for one more month in this situation as well.
Yes, we do really encourage people to continue to wear masks, particularly if they have any concerns or discomfort. You can continue to wear masks outside. You can continue to social distance. You can continue to be careful about washing hands and taking all of those precautions. We really encourage people to continue to take all of the precautions. Dr. Urbina, did you want to add anything?
And I would thank you. And I would say, Joe, get your vaccine as soon as you can.
And, the other comment I would make is that, some level of COVID-19 will be ongoing through the summer and likely through next winter. I mean, we'll just have a small amount, right? Hopefully. And so I guess my point being is that, and I lost my train of thought. I apologize. I'll come back to that.
Thank you for answering my question and hearing me out. I appreciate it.
You're welcome. Any other comments? Okay, not hearing any. We will move on to item 3. So our consent agenda item is a little longer because we have had a few special meetings. So we're approving the March 8th regular meeting, the March 17th special meeting, and the April 2nd special meeting. Are there any comments from board members on any of those? If not, please make a motion to approve the consent agenda.
Is it okay to do all 3 at once?
All 3 at once, I believe. Tammy, is that okay?
Yes, and if you have no need to pull any of them for further comment, you can approve them all with one motion.
Okay, this is Brooke, and I move to approve the March 8th, 2021 regular meeting minutes the March 17th, 2021 special meeting minutes, and the April 2nd, 2021 special meeting minutes.
Mrs. Morgan, I second.
Okay, motion and a second. All in favor? Aye.
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 Okay, thank you. Item 4, update on status of agency and recovery.
Thank you, Greg. So I just have a couple of slides I'd like to share that really are reflections on the transitions that we're hoping to see as vaccinations increase and we begin to move out of the crisis phase of this pandemic. It's really just a high-level view of how we see our work over the next 6 months, recognizing fully that the new executive director will be guiding us in this process, helping to operationalize the thinking and implementing once they're on board. But this really paints a picture of some of the things that are already underway and where we're spending some of our energy, but also how we're projecting out how we see the next few months. So really kind of thinking about it in terms of 3 phases towards recovery, the first of which is really about retaining and stabilizing the agency, particularly in terms of retaining staff and supporting staff to be able to function well, have strong mental health, and have the energy and enthusiasm to see us through this next 8 weeks. With so many changes in staffing, we have worked hard to increase communications, recognizing that that's really important during times of change. We are looking at, over the next month, thinking about how we begin to right-size staff on different teams and what those longer efforts for pandemic response will look like in terms of where we need to hold staffing in place. We're looking at, with the county, discussing what remote work policies might be and plans and preparations for returning to offices. We are also looking at ensuring that our core agency functions continue. We're doing a lot of thinking about budgets. We have a number of different funding sources that we're trying to manage at the same time, and thinking carefully about both short-term and long-term needs. And I know that we have an audit that's coming to the board next month and a draft budget in June. We're also doing an awful lot of hiring and onboarding of staff, and just a few examples at the leadership level include, as you know, the executive director, also the director of administration and finance, and the director of strategic initiatives, the latter 2 of which are both held by interim positions right now. I think you all know Angela Semental has now been named our communications manager. We're very happy to have her on board. We are also having final interviews for a family health manager and community health manager this week. And those are all just the leadership positions that we are working to fill right now. We're working hard to support stick factors so that staff want to stay with us, including developing a leadership initiative and advancing pay equity within the agency across multiple departments. We are investing significantly in providing staff mental health supports, which has made an enormous difference for our staff. They are extremely appreciative. There's a high participation rate, and we've seen a difference that it makes for folks to have those supports in place. We're also moving forward some high priority areas related to organizational development, including advancing racial equity among our staff, racial equity knowledge and relationships, which has been a very strong interest among our staff for a while, and we're moving forward with that work now, which is people are very excited about. Phase 2, so I see each of these phases in kind of a couple of months. Phase 2 is really about resting and restoring. Our staff need respite. Some of them have been working extraordinarily hard for over a year now, and they need a break. With that, they need to have time to, take some time for reflection and taking stock of what's happened over the last year. We'll need to do some light planning for immediate needs, and we'll begin to start thinking about how we bring our teams back together to be together again. Working virtually has worked remarkably well, but you know, there are we need to regain some of our cultural connectedness and coming back together and transitioning back to the office, as well as transitioning back to in-person client support. And then third, I think that would be followed by a phase of really re-energizing and recommitting within the public health staff. And that includes things like assessing what some of the emerging public health needs are, really planning for community recovery within the agency and with our county and community partners, advancing other key initiatives and strengthening the agency for the longer term. So these are just a few ideas that we're really thinking about a lot right now. And you know, it's not necessarily sequential across all of the agencies, departments. It may go in at different paces for different groups. But this kind of does reflect some of the major issues that we look forward to talking with new leadership as they come on board about.
Sounds great. What are you thinking? Okay, so I see that in your notes. So probably end of quarter 2, into quarter 3 for phase 2.
Yeah, I see them as kind of 2 months apiece, maybe April and May for phase 1, hopefully
Okay.
June and July for respite, reorganizing, and then really kind of getting into the real nitty-gritty of some of the heavier planning. Definitely by the time the executive director's on board and can guide that process with us.
All right.
Can I ask?
Yeah,
one quick
sorry, Greg,
question?
before we move on. Oh, can I jump
Oh
in?
yeah, we're not moving on.
Okay.
There's time for questions.
Sorry. Well, I thanks, Lexi, for sharing this with us, because I think this is, you know, this was something the board spent a bit of time talking about several months ago, about just how do we support staff and prevent staff burnout, because we recognized how long this journey was going to be for our community and just how much time and energy public health staff has been putting in for more than a year now. So, I just want to jump in and say, you know, the board continues to want to seek out all the different avenues that we can support staff. And I thank you for you stepping into this leadership role. And I just want to again emphasize how grateful we are, and that we are going to continue to need staff going forward. So thank you to everybody and the whole team, and please do keep the board informed as to how we can support the staff best. That's something we care a lot about.
Thank you.
I had a quick question. I was surprised to see pay equity on there. Could you talk a little bit more about that? Is this a big issue within the department?
This is an issue that we've been working as an agency on for a while. We have become very attuned to making sure that folks are compensated appropriately across public health and also between public health and other county departments. It's just a large cross-county initiative that we've been engaged in, and we're just going a little bit deeper on it.
Got it. Thank you.
Hey, Lexi, how do you get input on what staff might, I mean, I'm assuming it might be a menu of options in terms of the mental health resources and recovery. How do you go about identifying what might be the most strategic investment?
So Marcy Campbell is leading our internal mental health supports work, and Marcy works closely with the management team, which includes our division managers and managers in other parts of the agency, to really talk with them about what specific kinds of opportunities would be most helpful for them. She's developed a really robust range of different kinds of opportunities She does, and we work with outside contractors to deliver those. So some of them are group conversations. A number of them are specifically for particular groups. So I think that there's a BIPOC group, for instance, and sometimes they're divisionally focused. Sometimes they're cross-cut in a different way. Sometimes they're more formal. Sometimes they're very informal. We have Friday lunch sessions where folks get together in a more informal way. There's just a large combination, and she does a really good job of getting feedback from the staff about what's working and where we can adjust and what we need to tweak. We are expecting to continue to provide that kind of support for our staff for a bit longer. You know, you don't come out of these things as soon as the emergency's over. It takes time to really regain your whole sense of self, right? And so we just really want to make sure that folks have the opportunity in this space to really feel whole again, and to have the chance to be re-energized about the work that we have in front of us, because it's really very exciting work, and it'll be really great for the community when we're ready to step back into that space.
Good to hear. Thank you.
And speaking of mental health, have you all seen or heard any pushback on coming back to the office, or stress around returning to that new normal at the office?
That's a great question, Brooke. And in fact, we are talking about how we need to provide mental health support for that transition, because there are folks that, you know, have expressed anxiety about, you know, I've been working at home by myself for a long time and it feels a little odd to be around a big group of people now. So we're looking at how do we create a smooth transition for folks? How do we do it gradually and create flexibility so that people can re-enter at their comfort level without necessarily delaying too long? And just trying to provide support and structure for that process.
Got it. Thank you.
Yeah, I think one of the things I've been finding, you know, thinking back to the beginning of the pandemic and thinking, oh man, when people have the opportunity to go back to their regular work, they'll just be like, flip a switch. Mm-hmm. I mean, some folks have started with our organizations, have never done what they were hired to do. They've been helping on COVID. So that presents a different challenge. But yeah, that easing back into things and having that light planning period, because, you know, there's also opportunity to maybe do things a little bit differently than they were before while still getting the required work done. So yeah, it's a multi-pronged effort, and I commend you guys, and I'll be looking to poach a few really good ideas off the BCPH team.
We look forward to it.
Any other comments on this agenda item? Okay, on to item 5, which is the director's report. Well, we haven't had one of those in a while. Any questions on the director's report? If not, Lexi, I don't know if you're prepared to just give a quick summary of any highlights.
I'm not sure. I think you all are copied on our weekly newsletters now. And one of the things that we've been trying to do with the weekly newsletter is to reflect back a lot of what's happening in our divisions. And most of that information is really captured in the newsletter, and that's reflected here in the director's report. There are some details. One of the things that I think is really exciting to see is, you know, some of the non-COVID work that's beginning to pick up the pace, and seeing we're starting to get some additional grounding in resources to do some of the work that's ahead of us to do in terms of substance abuse prevention, in terms of working with youth, our LGBTQ+ plus programs, and being able to advance some of the tobacco education and prevention work. Very excited about the climate change strategic plan that is beginning to gain some momentum, and we're preparing to hire a specialist in that space. Just really being able to move some non-COVID pieces forward, even as we're still hiring folks in critical leadership positions. So, family health and community health are advancing their work, even as we're interviewing the managers for those divisions this week.
Okay, thank you. I know it's still a weird time because, we still have a lot of staff responding to COVID. So, yeah, but appreciate everybody who does offer input. It's still a informative read for the other programs as well. Okay, going once, going twice. All right, then finally, let's see here. We've got old and new business. Any announcements from board members? No, we've been meeting a lot lately, I guess. So it seems, there's just not as much time between various meetings. So it seems like we've been regularly in touch. And then finally, item 7, which is authorizes the executive session. And it looks like that's scheduled for the afternoon of April 23rd. So if somebody wants to offer that as a motion.
Yep, this is Morgan. I move to authorizing executive session for 1 p.m. on April 23rd, 2021, pursuant to Colorado Revised Statutes 24-6-4024F for purposes of conducting the public health director recruitment process.
This is Brooke. I second.
Okay, motion and a second. All in favor?
Aye.
Aye.
Okay. Well, that concludes our meeting for tonight. The time is now 6:52 p.m. and we are adjourned. Thank you very much, everybody.
Thanks, everyone.
Thank
Good night.
you.
Thank you.
Aye.